In a speech that touched on a range of key areas, Prime Minister Mottley said the institutional capacity of PAHO to deliver to our people and our region is fundamental to our existence if we are able to succeed. And reflecting on how what we eat impacts the level of chronic non-communicable diseases on the island and the region, she says being able to gauge the number of calories being consumed is critical.
How many people in here know the amount of calories in breadfruit cuckoo? How many people in here know the calories in meal cuckoo? How many people in here know the calories in oil down? How many people in here know the calories in green banana cuckoo? So that if we are going to literally ask our citizens to partner with us, then between our industrialists and the University of the West Indies, and I would humbly suggest, ma'am, the Pan American Health Organization, that we need to ensure that another 12 months does not pass without us giving our people access to the information so that they may make informed choices about Caribbean food.
And Prime Minister Mottley adds that citizens must partner with the state to foster best health practices, just as the state partners with entities like PAHO to utilize their expertise and resources to benefit the people. In this regard, she says funding continues to be critical, noting that Barbados has re-engaged with the WHO on a paused initiative to bolster the Health Ministry's expertise on healthcare financing.
Funding at the international level, that is why we speak to the need for not only countries contributing and not only having the World Bank have as its goal the reduction of poverty, but also the creation of a global common goods. And there can be no global common goods that does not speak to health care for all and the minimization or reduction of public health threats. It therefore means that the world has to be innovative in the same way that it has chosen yesterday to be innovative with the establishment of a loss and damage fund for climate. And the recognition, therefore, that if we are going to ensure that everyone, everywhere, can get the benefit of health care, then there must be the global common goods managed by a global entity.
Meanwhile, Prime Minister Mottley says she also wants to see the scope of community mental health care services broadened to include more training where necessary. She says this is especially so given the significant impact COVID has had on people's mental health over the past 2.5 years.
We have a duty now not only to have the Mental Health Commission launched and the instruments are being signed for those, but also to expand our community mental health programs, and secondly, to ensure that something as basic as a call hotline for people who need somebody to talk to because they don't have anybody to talk with, that be available to persons to help them get through this.
Ryan Broom, CBC News.